what about the so-called biostimulation, so in vogue, right, in trend nowadays? So I just want to show some things on Radiesse, on how versatile it is, mostly focused on biostimulation properties. Can we do that? Yeah, 20, yes. So I want you to think about something. Whenever I have a new product or a new technology or something that I'm interested in, I do a checklist. And biostimulator, I started using Radiesse in 2006 as a volume augmentation, dilute in 2011. So whenever I want to add something, and I used to use Sculptra since 2006, and we used for 8 years. In Brazil, it was when it was launched. So I want to see that all this are fulfilled. I can decide to use it anyway, but at least I know that something is missing or something is risky. So particle size, particle surface, the carrier, mechanism of action, type of collagen produced, layers that is treating in the injection, the distribution and publications that can support that. We know that Radiesse is a time-long thing. It's not like hyaluronic acid. You put, you see, that's it. So there's a publication of Yana Yutskowskaya where she did a split face with Ulthera and Radiesse on one side, Ulthera and saline in the other side. And interestingly, you see that in the 9th month of the side treated, you still see stimulation of vessels. Why is that? Where is it coming from? It's not biomechanical effect because you're not distending anymore. The distensive effect is gone. So what is happening there? The other side with Ulthera only, you don't see that. So mainly is the chemical effect also of the calcium interacting with the fibroblast. So it's a time thing to bring to regeneration. It's not from here to tomorrow. It's a philosophy. It's a long journey to go or to prevent. But every foreign body that enters in our body, being a makeup or being injected, will pass through immune mediation, right? So the body will recognize according to the particle size and the shape. If it is with the, let's say, a more friendly surface, and this shown by Lempel, how important this is, the more irregular, the more tendency for inflammation and granulomas. Why? Because of this process. So if you inject a particle like this or like this, your body will see it differently, and the proteins that falls on it like a fibrin to protect the body, and depending on how it falls, it would be recognized as a bad guy or a good guy. If it is recognized as a good guy or a bad guy, then the macrophage come and say, okay, you're a bad guy or a good guy. If you're a bad guy or a good guy, my differentiation is going to be different. And stimulation of fibroblasts will be different. Therefore, the capsule or regeneration will be a different process. This is more scarring and more collagen-based. This is regenerative approach with elastin, extracellular matrix, vessels. So they mimic, they allow the biointegration of this one. They want to isolate this one. I showed this morning a slide with histology of a scar and a skin treated with Radiesse, okay? And I didn't say what it was. I just showed. And I said, I want to tell you that I have a product. Before showing the images, I said, I want to tell you that I have a product that stimulates collagen type 1 a lot and collagen type 3. Would you use it? They said yes. So, well, but my product do this. Do you still want it? Scars are pure collagen. Is this what you really want? No. I want a balanced extracellular matrix. I want regeneration, right? So this is one thing to think about. This is what we want. Integration of the fibroblast, but it's not only the fibroblast. I need the GAGs, I need the extracellular matrix. And the extracellular matrix is not only in the dermis. All the superficial fascia system has extracellular matrix. We should not forget that. They are connected. Everything is connected from the skin to the fascia by the septi. So what do you want? I want a balanced extracellular matrix if I can. So Radiesse is very versatile and can be used as a booster. We have enough publications with that. But I want to touch base in some other important things like diffusion, integration, and etc. So there is many publications, less of Radiesse, less publications as a biostimulators, and a lot of publications as boosters. So combined with other procedures, boosting other procedures. As I showed here, this is a combination with Ulthera. And I could see 30% more collagen and elastin in the combination than the Radiesse alone. What about this study that I just published? This is a study of a SMAS. So this is a SMAS type 2 coming down in the skin, preauricular area, 6 months treated before facelift. My husband is a plastic surgeon, so easier for me. So you see the PAS. This is control, this is Ulthera, this is Ulthera, Radiesse, and Revive in the same session. It was triple the thickening of the SMAS and the skin. But all the boostering, so Ulthera alone has one thickening, Ulthera plus Radiesse was even bigger, Ulthera, Radiesse, and Revive was even bigger, 3 times. So that means Radiesse boosts the other procedures also. This is angiogenesis. This is the study of Jana. And you see 9 months. This is the blue one. 9 months after. You see big angiogenics, big elastic fibers. Where is this coming from? So this is the beauty of the double mechanism of Radiesse, biomechanical and chemical. These are the biopsies. So as a booster for any other procedure that we have tons of publications with Radiesse and technology, others like radiofrequency, other technologies you also can find. There's tons of publications of this, even in the consensus, the combination consensus. But this is what we're aiming for. New extracellular matrix, balanced. We're not looking for collagen alone. Not 1, not 3. We are looking for a balance. So this, I took some slides from studies I published. This is the study that I treated stria, showing the gain in the trichomium mason and the disposition. So the quality, it's also important. How the fibers are deposited are also important things to take into consideration. This is Picker series. This is the count of fiber 1 and 3, not only total collagen. So there's enough proving the elastin, the 3 pillars. Radiesse can give you the 3 pillars: collagen, elastin, and vessels. If this is true, when we combine those 2 treatments with other technologies, it can be radiofrequency, it can be Ulthera, could be a CO2, could be any other. We are summing up the mechanisms, and this is what we need. I just came from a meeting in Brussels, regenerative medicine. There was a lot of plastic surgeons mainly speaking about exosomes and fat, but what they realize is that one thing alone works, but you need inflammation to do the signal. Here is the same. You need, the more you put in layers, the better. That's why I think the study of this SMAS showed that combination of different layers, different procedures, so much bigger than the rest. But do we know what we're injecting? Because we have a lot of biostimulators. So I just want to show the particles. This is PLLA, this is Radiesse, this is the electron microscopy, this is caprolactone, this is Elance. It's completely plain. And I didn't bring harmonica, but harmonica is almost like this, but has some holes in it. So it's porous material. So this is a panel of what we have in the market. The gels, the carrier. Nobody took into account the carrier, right? The carrier was just a way, like toxin. If it's saline, if it's bacteriostatic saline, everything is the same. It's not true here. The recent publication I did in ASJ, that I studied all the biostimulators in the market to see how they shows that the marriage in between the carrier and the particles is one of the most important things to respect the anatomy when it distributes. Most of the products we have in the market do not respect the anatomy, they accumulate. This is the publication of Lampert showing these two things are important, surface and particle size, which Radiesse accomplished. But what about other things? Size and safety, we knew, surface, but what about diffusion, dilution, depth, against efficacy, adverse events? So from all the list, we have already ticked this, but still missing this. I want to tick all of them. So then I did another study. So this is different biostimulators, just a bolus, just to see how they look like. And let's see, this is Radiesse 1 to 2, the shape, 3D shape, and this is Radiesse after. So you see that when you dilute, this is how it looks inside, right after you inject. Okay, great. But I wanted to understand if only the shape, but then it changes in 5 minutes, in 20 minutes. Does massage change this or not, how it distributes? So I was curious about it. And this is Radiesse in bolus. This is a non-dilute. See that it's very different. So the 3D shape of both is very different, right? Just for you to bear in mind. So this is Radiesse 1 to 2. Let's compare with other products. My needle is here. The product is being injected. And this is a PLLA. It seems like good distribution, right? The saline is going everywhere, right? Seemed to me like good. This one too. You're going to see I'm injecting subdermal. It seemed okay. But this is immediately after. You have to see afterwards. After 20 minutes, this is Sculptra. I'm not saying the product is bad or anything. I'm not saying this. Sculptra can have a good action in many places for many things. But what is the rationale of making so many granulomas? Is just the particle irregularity? I don't believe so. I believe they're not customizing the technique for the product they have. They don't have a friend, they don't have a marriage, good marriage in between the saline and the product. It's positively polarized, so it tends to accumulation. So no matter how much you dilute, and this is dilution to 20. After 20 minutes, this is how it looks like, in the middle of the fat, always. So you inject a dermal, it goes in the middle of the fat for some reason. Where you inject it, it creates crusters. This is how it acts. I injected 20 different skins. This is the shape of Ilanse, which is caprolactone. Diluted, also, trying to mimic the same of Radiesse. It doesn't diffuse. I thought this was an artifact, maybe distributed, and it is so white, the particle reflects so much the light, the ultrasound, that you cannot see. But then I injected colored material to the skin, massaged and pictured it, and the shape is exactly the same. So that means it doesn't distribute, it accumulates. What about Profilo? Profilo claims to be biostimulator, but there's no publication on it. But anyway, they say that, right? But they say they're non-cross-linked. But they behave like a cross-link. They're hybrid cross-linked, but they are cross-linked in a different way that we don't understand, because I couldn't find completely in the publications and the FDA how it worked. But the FDA know the CE market. But this is how it looked like. It looks to me like a cohesive product that created a bolus. This is injection of Radiesse Plus. This is the 3D shape of Radiesse Plus and volume, just for you to see after injection in the fascia. This is Harmonica, deep bolus injection, just for you to have a look on the shapes. So if you think about this, then if you think about, okay, they are different products. That's why the 3D shape is different. But what about caprolactone and CMC? They have the same vehicle. They should have the same distribution. That's not true, right? Because the marriage in between the vehicle and the particle is not complete. So Radiesse is regular, have 25 to 45 microns, is nanotexture, as I called, to mimic the breast implants, gel CMC, and 30%. How many layers are we treating? If I inject subdermal, and I injected all the products subdermal, am I treating only subdermal, or my product is distributing through the septide to the fascia, which is what I want, to treat the skin envelope, not only the skin part. I need to tighten, especially in the body. So this is Radiesse in different dilutions. You see, the more you dilute, the deeper you go, the more lateral spread you have. That doesn't mean this is the best dilution for treatment, but I'm just showing it diffuses more. But I want you to look at something. Look at the pattern of distribution. It mimics the fascia system. If you look at this case injected after a month, in the ultrasound, those white things blurry are Radiesse. And if you look at this one, you will see particles along the septide, but no particles in the fat. There's no accumulation of product in the fat, even though I injected subdermal. I didn't inject in the fascia. So the particles, as we saw in the ultrasound, are going down for some reason that I don't know. The gel creates a toboggan, and the particles flow. Very good. This is, again, in terms of layers. This is Profilo after massage, treating only subdermally, which makes the effect they're expecting. Absorb water, creates a little bit glow for some time, and then it goes away, right? But this, it's not biostimulating anything. It's just absorbing water. Maybe they didn't prove anything like biostimulation per se, but anyhow, maybe biomechanical effect, but it's not really a biostimulator. Here, you have Elance. And this is not more immediately after. This is more. So is it treating the whole system? No, it stays as a sausage when you put. This is Lanluma. You see it accumulates in an area. And this is Sculptra. This is Harmonica. And the Harmonica I diluted like Radiesse, 1:1. And this is how it looks like after massage. So it's not distributing in layers. It's not treating all the layers. This is the comparison of all of them, but this you already saw before. What about massage? Should we massage or tell our patients to massage at home? Doesn't change after 5 minutes. Huh? And I accompanied for 20. After 5, you don't see any change. So here you see that it's changing. Here I even changed the transducer because I needed to get deeper because it goes deeper. It respects the fascia. It goes subdermal, fascia, and fascia. So 5 minutes, and that's it. So you massage in the office, you tell patients, don't even bother. This is 1 to 2, just to show the difference. This is Profilo after massage. This is Elance after massage. This is Sculptra immediately after. And then start concentrated. Oh, sorry, this is Lanluma. And this is Sculptra. It accumulates. And then it gets to this. And it's interesting because in the ultrasound, you see the particles like this, blinking, 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 and start disappearing, and it start accumulating in one spot. This is Harmonica. It doesn't change anything with the massage, absolutely. So don't even bother to tell your patients to massage because it won't make any difference. This is the deep injections, right? So Radiesse Plus do a very small difference. So when somebody tells you, put a bolus. If you think it's too big, just massage. It won't go away. It won't go away. It flattens out a little bit, as you can see, but it doesn't like spread and go, no. Radiesse plus giving a little bit more. Radiesse plus, no, a volume, but not so much neither. I just wanted to put them together. This is harmonica non-dilute in the depth, like a bolus. Thinking about volume augmentation, okay, for harmonica. And this is what happened when you massage. So the hyaluronic acid is not viscous or have a G prime enough to keep. So when you massage and you apply shear force, it spread. So then I think, in my opinion, we could tick on all this. This is a good biostimulator I can use. How am I going to use it? So to get to the target, some things are important. Needle or cannula. Some of my friends would say, nah, this is a matter of preference. I would say this is a matter of being effective or not. Why? Because when you inject with a cannula, you see the spread of the colored material, 1:1 and 1:2. It's completely different from needle. So if you want Radiesse as a biostimulator, needle is not your friend. Otherwise, you have to do 1 per every 5 millimeters. It's too much, okay? Amount of particles per area. So we discovered with the Skin Lab of MERS, this is another publication we did the beginning of this year, the more particles in contact, save this part, in contact. If the fibroblast is here, the particle is there, forget about it. It won't stimulate anything. Here it has to be in contact. So the more particles in contact, the more protein expression, the more fibroblast migration you get, the more collagen stimulation in an area. But what dilution has to do with that? So I proved in this study that the less dilution, the more particles per area, the more dilutions, the less particle per area. You're going to have less result. Bear in mind that if you dilute 1:2, 1:3, 1:4, you're going to have much less particles per area. You're going to have much less stimulation per area. You might have to do more sessions. How do we divide the areas? So in the consensus of 2017, we decided that 1 syringe of 1.5 is for 100 centimeters square. If you use dilution 1:1 and you inject from the center, you're going to keep in the square. If you inject 1:2 and you keep in the center, you're going to treat 30% more of the square because it distributes. Bear in mind also that. So if you're using more diluted, I mean, don't inject from the border of the square of the area. Inject a little bit smaller. It will spread to the area. It's another thing you can do to protect. And this just example of areas of 100 centimeters square, 20 by 5. That's it. The different calculations. So where do I use? I just brought some, okay, because I use for tons of things. These are 3 patients, same severity, different complexities. This patient is menopaused, 10 years post-facelift. This patient has severe acne scars here. This patient has acne scar, menopause. So do you think they can be treated the same? They have the same severity. We use the same protocol. No. You have to take into account the complexities that might make your treatment more complicated. So I came up with looking into 3,000 patients I treated, and I came up with a pattern. So green patients are here. Yellow patients, red patients. Anything in between this and this is for combination. It's not for one treatment only. And this is the protocol of Radiesse that I use. So according to the severity, I use one different. If there's complexities, that means I have to combine something more. So my protocol of approach for Radiesse is this. You're going to see in the patient. But remember, if you're treating only lateral face, you can use half a syringe each site, is 100 centimeters square. But if you're already using in the neck, here, here, then you have to use 1 syringe per side because it's more than 100 centimeters square. Upper neck, this is the protocol I use. Lower neck, this is for young. Combination of both. This is behind the sternocleidomastoideus. This is for more severe anterior neck laxity. So you have to combine the protocols that you're using. So the important thing with Radiesse is you're going to see is to mark, know where you want to inject, do homogeneous injection subdermally, guarantee, especially in the body, like the buttocks, the chest, that you're not too deep, because you accumulate the product not in the best area for distribution. If you put in the fascia, it's not going to distribute up. You have to be subdermal to distribute down. And this is the result of the patients. Obviously, it was not Radiesse dilute only. They were patient for combination because they were patient grade 3. This is just Ulthera. And then this is just the achievement of Ulthera in 3 months. And then I combine Radiesse dilute to get here. This is the lateral approach. I would have put microneedling here also, definitely something more superficial, because they need, especially acne scars. And this is the other patient. So of course I used Belthera here, I used Dioming here, I used Ulthera, and I used Radiesse dilute. When I go for the chest, this is different than the face. So the chest, I'm more aggressive with the amounts when I treat with Radiesse. So I realized, and I published as a communication for JCD, that we cannot base all our protocols in this, because this is what they use for FDA, CE mark. Normally the patients are grade 2. But we have I have a lot of patients grade 3 and 4. How can I treat these patients like this one? I will never have a result. So either I enhance the number of syringes per session, 2 syringes per 100 centimeters square, or I do more sessions. You can do 4 sessions here. You can do 5. But I cannot treat this patient like this and expect the same result. You have to customize your treatments. So chest for youngers, normally I use this. For more severe chests, I also treat the lateral part. This is a chest I treated with 2 syringes every session on the chest, because I also treated the lateral part. And this is how it looked like. This is another one. Hands for me is also another big hit, because sometimes everything looks great, chest looks great, facial surgery, everything is fine, the hand looks awful. So it doesn't. But here we have 2 problems. We don't have lifting in the hand, but we have skin quality and volume. So how do I do that? This is normally what I use in Radiesse, but not all as a biostimulator. I can combine like volume and biostimulator in the same syringe. So for a mild, I would do only biostimulation. If I need volume, I do in between the tendons, the volume. Then I take the rest of the syringe in that hand, dilute. Or you take 2 syringes, you dilute one, you don't dilute the other one, or you dilute to 0.3, the classic, and you put as a bolus. So you take 1 syringe per hand, but then you use half for volume, half for biostimulation. And you can also use AJ for that. So you're going to see in this video that I'm not doing hand in the patient, so I think it's maybe nice to see. This is a technique, make your patient grab a bow or something and do like this, because where I put my point of entrance here is the last wrinkle of the wrist, here. So this is where I enter. And it makes it much easier for you to glide in the superficial lamina of the hand, which is the safest way to inject, where you're above the vessels, so you don't give bruisings also. So you make tiny bolus. It's fast because I fastened the video. But I make rosarios, you know, tiny bolus of 0.03 in between the tendons. And then I move to the Radiesse dilute, which I go on top of the tendons, doing retrograde. So this is the difference in between both. I'm going in the middle of the tendons, or I'm doing an approach where you go above and everywhere to give a volume correction. The other thing I like to do here is to use Revive on the fingers. So you can take Revive, entering here, and then you do the injection in this, at this level. I don't know if I have, I think I have in this video. So, because I don't inject Radiesse here, because you're too close to the fascia anyway. So I just don't inject. So I did the volume first, and now I'm doing the Radiesse dilute, and you see that I don't mind being in the middle of the tendons because I don't want to give volume. I just want to cover and create a coverage for the veins and create a stimulation for the skin. So I go everywhere on top of what I did before. And then you can put Revive on the knuckles. I can advance, so you can, no, it won't let me advance. That's fine. But you can treat with a cannula in the lateral part of the finger to correct this wrinkly, because then the hand gets super nice and the fingers get, so trying to improve. And the gluteal area, which is also a matter of volume. So you have skin quality, the lifting, and also the volume. Obviously, these patients are for combination. As I said this morning, I don't treat Radiesse in the cheeks. I use on the lateral part. I want to tighten the fascia and create the Spanx effect. So you would create an illusion of the cheeks being more projected or bigger because you're tightening the lateral side. Plus, you're improving the cellulite and the laxity appearance. So this is how I inject subdermally. So you mark before the 10 by 10 areas. You see 10 by 10 areas. And then I inject 1 syringe per 10 by 10 area. I either use a cannula of 18 gauge or 22. 18 is easier to pass. So normally I use 18. And this is from this is a year after, only Radiesse. This is a year after. Actually, this was the combination of Ulthera and Radiesse. So Spanx effect, the treatment only on the lateral side. This is a year after. It's another patient. Very good improvement. This patient had lipoaspiration here, and she had a lot of irregularities, and it got better because he improved the laxity. Another patient, very dramatic Spanx effect. And this is a patient where we combined Radiesse, Ulthera, and Silphina at the time, and it got a really good result for her age, 55. So my message is we have to combine. But what I learned for me in the last 3 years that changed my priorities is skin quality. I did this patient with Ulthera and Radiesse 6 months before I went to an event. I was doing a live event. I calculated the amount based on this, sent to the ladies there, and I said, okay, I'm gonna use 9 syringes of filler. I got to the event and I said, wow, why there's so much product left? She said, well, didn't use everything you ordered. Really? And I started looking, why is it happening? So what happened here is that the skin quality is the balloon effect. If you take a balloon, you put a certain amount of air inside, beautiful, shiny, elastic, leave the air for a week, take the air out, try to put the same amount of air again and get the same shape and the same shiny. Forget about it. You have to put 3 times the same air. This is us putting filler in our patients. But to get the same effect I had 5 years ago, I have to put 5 syringes more because we're not taking into account the skin quality. We have to have a good skin quality tightening effect. And this is the result I could get, but I was impressed with this. I had the lifting okay, but look at the vessels. It was all winter, 6 months, so there's no season. Improvement of pores, improvement of pigment. What are we doing here, right? I think we're gonna know in the future. And this was my plan. This was, I literally used less. Why? Because I have the tightening that is reflecting. So everything is corroborating. As I said before, we age in layers and in vectors. So we are the tightening effect. So skin quality for me was a game changer. If I have a bad skin quality, I prefer to use Radiesse, dilute, or combinations to tighten the skin first, and then I blow the balloon. And I think this is something for us to think about, because sometimes in our plans, we plan to do the filler first and then the rest. But again, inform your patient about his condition or her. Even if she wants to start, she knows that you notice that the skin quality will make her use much more product than she would if she had a good skin quality. Thank you.